When a baby is first born, the APGAR scale is used to assess the baby's condition within the first 5 minutes after birth. The A stands for appearance or color, P stands for pulse or heart rate, G stands for grimace, A stands for activity or muscle tone, and R stands for respiration or breathing. So immediately after the baby is born, first the doctor will take a look at the skin tone of the baby. If the baby's skin is blue or pale, the baby will receive a 0. If the baby's body is pink, but the extremities are blue, meaning the arms and the legs, then the baby will receive a 1. What we want is that the baby's entire body is entirely pink, and then the baby will receive a 2. Next, the doctor will assess the baby's pulse or heart rate. If the baby's pulse is absent, then the baby receives a 0. If the baby's pulse is slow, below 100, then the baby receives a 1. What we want is that the baby has a rapid pulse and heart rate over 100, and then the baby will receive a 2. Next, the doctor will assess the baby's grimace response. If the baby has no response, then the baby receives a 0. If the baby does grimace, then the baby receives a 1. And what we want is that the baby is coughing, sneezing, and crying, and then the baby will receive a 2. Next, the baby's muscle tone will be assessed. If the baby's muscle tone is limp, if the body is limp, then the baby receives a 0. If the baby's muscle tone is weak and inactive, then the baby receives a 1. And then what we want is that the baby has a strong and active muscle tone, and then the baby will receive a 2. Lastly, the baby's respiration will be assessed. If the baby is not breathing, then the baby receives a 0. If the baby's breathing is irregular or slow, the baby will receive a 1. And what we want is that the baby is crying, and then that indicates good respiration, and the baby will receive a 2. Then, if the baby receives a 7 to 10 points on this APGAR scale, that indicates good to excellent health. If the baby receives a 5 to 7 points, then the doctor should immediately establish breathing. And if the baby receives 4 or below on the APGAR scale, this indicates that the baby needs life-saving treatment. And that's the way the APGAR scale works.